Now I want to head to Connecticut. The governor, Ned Lamont, joins us now, currently in self-quarantine after one of his officials tested positive. Governor, thank you for joining us this morning. Your state hit new infection highs, more than 4,000 on Monday. But despite that, you said you will not do another lockdown. Are you confident you can get a handle on this without more drastic measures?
We've had some of the lowest infection rates in the country until recently, Stephanie. We kept our bars closed. We're shutting down restaurants at 10 o'clock at night. No high school sports, at least until January. Doing all this in hopes of keeping at least our K-8 education open. But look, I've met with all the regional governors here in the Northeast, and if the facts dictate, we're going to take other actions.
During the surge in the spring, your state was able to borrow hospital supplies and personnel from other states that had low infection rates. Today, we don't have any states with low infection rates. So what do you do?
Well, we've got a good supply of PPE. We put together our own stockpile. The hospitals have done that. We know we can get the field hospitals up in 48 hours so we can maximize beds as needed. But I'll tell you, our choke point's going to be nurses and docs. They're stretched. They've been working flat out. And now if we ramp up, I can't go to other states and try and find people to help them.
Do you have a plan for how to distribute a vaccine when it becomes available?
We do. Deirdre Gifford, our public health, has put together the commission. We've got relationships with the major pharmacies. They're going to be able to, route out that very quickly, as well as to our nursing homes. Our hospitals have the deep freeze capability. Pfizer will deliver their vaccine in dry ice. We have to get it out the door and people vaccinated within a short period of time. We're working on it. I think we're going to be ready, but it is a Herculean effort. We've got 3.5 million people.
At one point, your state had a $3 billion rainy day fund. I think it's safe to say it's raining right now. Is that an option to dip into that and help the people suffering there?
I'll tell you, if the federal government is going to stay asleep at the switch a little bit longer, which is a terrible choice for them, the states have got to step up. I do have a $3 billion rainy day fund. Our first priority is going to be making sure everybody has the PPE, making sure that everybody has the vaccination, putting in place the infrastructure, hoping that the federal government will step in after January 20th and make good.
Governor, thank you so much for joining us, and I'm wishing you the best of health.
Stephanie, thanks, everybody.